All right, we're going to go ahead and get started and let people join us as they are able to. So thank you so much for joining to spend some of your evening with us discussing COVID-19 and its impact on women of color. I'm Christina Pei, Housing Up's Vice President of Philanthropy and Communications. Housing Up currently serves about 900 families throughout the district, providing affordable housing and support services, and the majority of our families are led by women of color. And as we all know, the pandemic has drastically highlighted and heightened the inequities low-income women of color face. They've been laid off in record numbers. There are fewer safe and affordable childcare resources, and mandated reporters have had fewer interactions with families at risk of experiencing domestic violence. So it's almost a perfect storm for a pandemic within a pandemic. And tonight, I'm joined by three women who are working to address many of these challenges. First, we have Michelle Sewell. Hi, Michelle. From DC Safe, the only 24/7 crisis intervention agency for domestic violence here in the district. Michelle is DC Safe's crisis shelter director and has more than 20 years of experience in human services. Her focus includes development, operations, and evaluations of innovative counseling, education, training, and empowerment programs for at-risk women facing incarceration, drug addiction, domestic violence, and homelessness. Thank you for joining us, Michelle. Next, we have Sonia Gahimbare. Sonia is the clinical manager for Housing Up's permanent supportive housing program that serves close to 300 households right now. She has been with Housing Up for 3 years as a licensed independent clinical social worker who provides clinical guidance and program management to the PSH department. And hi, Sonia. And lastly, we have Liz Reiner. Liz is the executive director at Suited for Change, a leading nonprofit in DC for women who need professional attire, mentoring, and job readiness education. Previously, Liz was a leader at DC Central Kitchen and Food for Others, the largest provider of free food for families in Northern Virginia. So before we dive in, a few housekeeping notes. If you have any questions, feel free to add them to the chat feature. We'll be saving some time towards the end of our discussion today for your questions. I think all of our panelists have water or tea or coffee ready to go. So we'll dive right in, and I'll start with the biggest question. If we could probably spend all evening just on this, but how has COVID-19 exacerbated existing inequalities or made life more challenging for the communities that you serve?
I think for us at DC Safe, what we saw almost immediately, services cut down, just stopped, in its tracks, was how impacted our mental health consumers were impacted. A lot of them depend on their community support workers who, everybody's concerned about this virus. All these things went offline. And so those community workers also went offline and became remote. And a lot of our mental health consumers were significantly impacted. They didn't have their providers, they couldn't get to their medication, they didn't have the safety plans that they were used to, and they were interacting with our response line on a different rate that they had done before. And so I would say definitely for us, we noticed the mental health community was impacted almost immediately.
Yeah, to kind of piggyback on that, a lot of the clients that we serve rely on all of these community resources, and including DC Safe, including the district's mental health response teams, people who didn't know how to get their medication, people who had issues just staying quarantined. I think while this pandemic has definitely exacerbated a lot of inequities, I think that it also shone a light on all of the existing inequities and how there's oftentimes this domino effect of issues. Like if you can't get food to your home, then you have to travel. Oftentimes you're traveling by the bus, and then oftentimes you're, so all of these things kind of play off of each other. And I think, and I'm hoping that people have become more enlightened about how all of these existing inequities are impacting women of color disproportionately. And I'm hoping that we can get to some resolves that can provide a better kind of system of support so that when these issues come up, or in general, we're able to provide support to the most vulnerable populations that we have.
Well, and I think for Suited for Change, we're so reliant on referrals from other organizations that while we were there, we reopened on June 22nd with phase 2. We went from serving 50 clients a week to five clients a week. And that has been the status quo since June. Even at the beginning of this year, we've served 50 people in the first quarter, where we used to serve 50 people a week. So that's a combination of a lot of things, obviously. But the nonprofit communities, it often feels to me like we just circled our wagons and stopped working together with each other and stayed in our own lanes, and the less people were helped, at least on our end. That's been a big challenge for us to reach our community.
Yeah, absolutely. And we know that it's not like women do not need the resources that you provide right now. Looking at just talking for a minute about, the national trends right now. And I know that many of you saw that staggering statistic that last fall of 865,000 women leaving the workforce in 1 month, just in September of 2020. Since February of 2020, 2.3 million women have dropped out of the workforce. And the pandemic has also hampered the already struggling daycare industry. I think they're estimating 4.5 million childcare slots that might be lost permanently. And of course, when we delve a little bit deeper into those stats, we see how the intersections of race and gender also dictate unemployment or employment and income. And kind of, Michelle, to come back to you for a minute, in midst of all of those economic trends and unemployment trends, we've also seen a huge rise in cases of intimate partner abuse, family abuse, and then also compounded with the lack of mandated reporting and seeing those families. So what have you been seeing at DC Safe? What are people saying when they come to you, or are they able to come to you even? The shelter at home is not safe for everyone. We know that. So
exactly. I think now that we're sort of coming out on the other side, the vaccine is sort of what everybody's talking about. I think we're starting to have amnesia about what the first 6 months of this was like. I'll tell you that for DC Safe, our response line, which is already a 24-hour line, our calls just went through the roof. I think what Liz said, that a lot of partner agencies closed down or went remote or was trying to figure out how they were going to provide services. And so because we stayed online, right? Our shelter continued to run. Our advocates were still available. We still had our on-call staff going out into the community to hotel placements. People started getting the word that call DC Safe. And so our call volume went off the charts. What we saw that what an already fragile home life was now people trying to decide, was I going to quarantine with my abuser, or was I going to risk going into a shelter where I might be exposed to COVID? And people sometimes chose the abuser. And it wouldn't be until we saw them with broken bones or black eyes or triaging at hospitals that they were able to then be reconnected to us. We saw our MPD, the police department, calls go up because neighbors were calling, because the couple that used to just kind of fight, now this was, again, off the charts. And so we were seeing more and more really escalated episodes where maybe we get, there's arguing, there's, people, I want him to leave. Now we were getting, people being dragged downstairs, being pushed out into the elements, kicking in doors, like the aggression and the violence of it was escalating, absolutely. Then there were kids who were home, right? So school's offline.
Right.
There are all these people who would normally have eyes on kids. they're at home as well. And so we also have these children who are being exposed to this violence. We were having, if there was drug abuse in the home, the technology that was being sent home with the kids so they could participate online, somebody in the home is stealing the technology or selling it or breaking it in the violence that's happening. And so the kids are also dealing with that. Even if the child directly wasn't injured, they were being exposed to all this trauma. So we definitely saw really, really broken up families over this. Yeah. And the first 6 months was really tough, really, really tough.
Absolutely. And actually, speaking of trauma and, exposure to trauma, Sonia, dealing with your clinical provider, what have you seen even with, the housing up families? COVID-19 has, increased conversations about health access and the importance of mental health support. And so what challenges and changes have you seen this past year?
Yeah. And I think just kind of going back to housing, I think one of the most obvious parts about COVID is that you need a home to quarantine in. Like, you need a home to be able to actually, stay safe from the elements. And so I'm hoping that kind of puts that conversation back into, everybody's awareness and consciousness. But when it comes to our families, the biggest struggle with the families that we serve is visibility. Like Michelle was saying, we don't have access. The whole model of our case management services is relying on us home visiting. It's relying on us going into the community, going into people's homes. There's things that you can infer or assess from actually visibly seeing the space versus calling somebody and getting it from that vantage point. So the visibility has been the biggest struggle. And like Michelle was saying, because we don't have visibility, normally we would be the ones to call, the DC Safe or call the mobile crisis line. However, because we don't see it until it escalates to the point of maybe a landlord contacting us or somebody else or even, the police getting involved. We were getting a lot of things secondhand, thirdhand, and we're not able to really be proactive in, getting people the services that they need because of, just how quickly things escalate in the home and because of our lack of visibility. One of the things that I guess I'm not that surprised that this is happening, but we've seen quite a lot of suicidal ideation and attempts from children. A lot of the unusual incidents we're receiving lately has been children maybe saying something on a Zoom call in class that alarms a teacher, or children just behaving in a way where we can't really figure out what the trigger is. But I would imagine that the combination of being in a home with, your siblings and your parents, when that's not what you're used to, maybe a home that was already a little bit volatile, and not being able to have respite from your family home, I'm sure that contributes to it a lot. So we've seen a lot of a rise in mental health, more severe mental health in the children. And in terms of the parents, they definitely are, mental health, a lot of mental health or mental health in general is exacerbated by stress. Like, your body goes into a stress response, and that oftentimes will trigger maybe some mental health issues that were dormant at the time. And so a combination of having all of your kids at home with, all of the anxiety around the pandemic, with, maybe being food insecure or, not having enough money. Now that all the kids are home, that means that not only are all the utilities being used all the time, so your bills are higher, but it also means that you have to feed the kids now regularly. It now means that all the toiletries, are being used up more quickly. So all of these kind of small things are compounded, and they lead to, parents just really feeling overwhelmed, and really feeling like they don't have any place to turn. So Our greatest, I guess, strength in terms of housing up is that we were able, like we increased our contacts with our clients almost immediately. We went from, engaging with them, maybe twice a month to engaging with them on a weekly basis. So we really tried to to maintain a sense of normalcy for them in the sense that they weren't in this alone. But yeah, it was definitely a struggle. And I'm sure that the ramifications of it on the other side, I think we're going to see some things when it relates to, the moratorium being lifted and all of these families who've had these really high rental arrears and what's going to happen with that. I think that's going to be our next big challenge.
Yeah, absolutely.
Sonia, definitely. I was just thinking that when we'd get families into the shelters, the level of stress that the survivor was under, we sometimes would find ourselves having to call Child Protective Services because that stress was being acted out on the children. Maybe she had spent so much time in the home with the abuser trying to protect the kids that once she got sort of in our space, every little thing could be a trigger because she's not in her own home, the kids are upset, she's upset, the respondent might be acting out. Absolutely. We saw that immediately just everybody would fall apart once they got there. Absolutely.
And how do you kind of combat that, knowing that the pandemic is not, we're still in it. There's the factors that led them to the shelter in the first place aren't going to go away just with a vaccination shot, right? So how do you provide the resources and support to kind of stabilize them in a very unstable situation?
I think for us, we've really had to start using the notion, I mean, obviously we had, but this sort of really forced it to the front of these really transparent conversations, right? Like our clients are whole people, right? And this domestic violence event is a part of their life, but it's not their whole life, right? And so Sonia talking about their $4,000 in arrears, right? They have not been paying their rent. Mom has been laid off because of COVID. She's not going to Liz's program anymore because there's no job to go to, right? And so talking about sort of what's going to be left behind and how can we manage that. Now, we've tried to work really closely with the city because they are trying to offset some of these challenges that everybody can see coming down the pike, especially with like the ERAP program, the emergency rental assistance, and now they've cut out some of the barriers that had been in place before because they're going to have a wall of people who are going to be homeless. It's the moment this moratorium goes away, landlords who've been also suffering, right? They're going to start evicting people. And there's no client I've met who's not at least $4,000 behind on their rent, minimum, right? And so trying to talk about that, like trying to figure out how to create more bandwidth so they can, yes, let's talk about the temporary protection order. Let's talk about the police assistance here, but let's talk about what's happening at home, right? How do we get the kids back online? How do we get you in the ERAP program? How do we talk about going back to work? And I know that sounds like a lot, but we can see it, right? We can see that wall coming down. And so we're trying to be as proactive as we can be and maybe talking about some issues that we normally don't handle because usually clients are really with us a short period of time. But even with the pandemic, we had to extend our stay. We went from 14 days averaging to 47, right? Wow. There was nowhere to put people, right? They couldn't go back home, right? And as these other programs slowly came back online, we could connect, right? One of our biggest partners for families was Virginia Williams. And that's what sort of saved us. We could create a transition. And so we could create a vacancy for the next family. But it really has forced us to sort of start looking further down the road than maybe we've had. We usually look like, give us 30 days. We're now looking at 6 months and like, okay, Ms. Smith, know that that's coming. Like, how do we help you with that? How do we get you in compliance with this? It's been fascinating. And I'm also it's just curious watching people forget, right? As people are starting to come back online and I got my second vaccine shot. I did, right? But I'm still mask and I'm still at work and it's been interesting in the last month or so. Like people are like ready for their summer break and I'm like, that wall is about to come down.
Yeah.
That wall.
Absolutely. Liz, talking about what Suited for Change does and, you know, employment counseling and all of that stuff, how do you go about that in the midst of record high unemployment and job loss? And, you know, especially thinking about the industries most hardest hit are also the industries that employ the most women of color.
Yeah, we, like both Sonia and Michelle said, we just realized we would have to think about things differently. And we weren't getting referrals to us, but at the same time, we knew that there were all of these women out there that were suffering and that were feeling bad about themselves. And they, all of the things that you talked about, they were feeling so isolated. And we thought, well, you know what, we've got 300 women's phone numbers. We suited 300 women after we reopened. And we just started calling them. And we just called every single client that we had seen in 2019, inviting them to have two things. We started a virtual suiting program and we started a virtual coaching program. And the virtual coaching program didn't even exist until the pandemic. And we trained about 5 volunteers, which is not a lot, but the number of people that we were finding was so low. And we just started reaching out and offering them professional mentoring and coaching by Zoom. And at the last quarter of last year, we did virtually coach 46 women, and then we've done about 30 so far this year. So we just started reaching out to them and saying, well, you know, would you like to work on your resume over Zoom, you know? And then we also started virtually suiting, just because we realized when we started calling these women that 90% of them that had gotten jobs had lost them again. And like Michelle said, there was just no hope. And we started offering virtual suiting, which is, you know, given the gravity of the things that Michelle and Sonia are seeing, seems very frivolous, but we started having women just meet with a stylist on Zoom and talk to them about themselves and how they're feeling, and had them pick out some clothes, which we mail to them. And again, given the gravity of what you all are seeing, it's such a Band-Aid, but we just wanted to reach out to women and let them know that they're not alone and that we will be here when they're ready to try again. And so we've just been reaching out to every phone number that we have, and, you know, expanding our social media presence to try and capture, you know, clients, not just donors, you know, to try and reach the women that are out there. We've reached out to all of our referral partners several times now, just reminding them, you know, we're still here. If you need us, if you have a woman that needs something. We just did a virtual workshop last night with a group in Fairfax County, because virtually we can expand our reach. And these women needed job coaching. They're going on interviews. And so we set them all up. So like Sonia and Michelle said, you know, we're just trying to stay present. And I hear you, Michelle. I can't imagine how slammed we're all gonna be. You know? So we just keep doing, you know, I keep training my volunteers. And another thing that I've invested in is some diversity and inclusion training and some trauma-informed care, because I do think that we're gonna see a completely different woman at the end of this. And we're all going to need to prepare to meet her with empathy and patience. So.
And I'll say, Liz, that, you know, those sorts of things, those small things like getting fitted for an outfit or, you know, getting clothes delivered to you, those are the type of things that build that bandwidth that Michelle was speaking about. Like, those are the type of things that help people cope when they are struggling. And so definitely, I think those things are really necessary. And I think, like you were speaking to earlier, I do think that maybe we need to kind of reset as providers to work together to fill in those gaps, you know, because sometimes, you know, I think it's going to take a village to kind of help support these families again. And I think the more that we work in collaboration with each other to fill in those gaps, the better, for sure.
I couldn't agree more. That's the main reason that I wanted to be a part of this, just so I can meet you. And you know, I mean, I know that both of you have a caseload, you know, caseloads of women, and I have, it's not, it may not be the exact resources they need, but they're resources that they will need. I have trained volunteers who are willing to just, I mean, we've had volunteers just writing cards to send with these boxes of clothing that just say, you know, hey, you're awesome, and here's our phone number if you need help. And it's anything that we can do, we're all going to need to work together. And that's, I'm so grateful to know that you're out there.
Yeah, I think the feeling is mutual, Liz. You know, talking about, you know, the rest of this year and beyond, we've talked a little bit about that, you know, having a new woman, a new family dynamic that we're going to be dealing with. Michelle, you mentioned referring your DC Safe clients to Virginia Williams, which is all part of, you know, we get most of our families from Virginia Williams. It's all part of the referral system. It's one big loop here. So, you know, what do we know that homelessness is likely going to be increasing, right? Family homelessness across the board. So what trends are you expecting to see for the rest of this year into 2022? Are there obviously challenges, but are there any opportunities? Are there any positive things that we can talk about?
I think like Liz pointed on, like people started to silo out, but that was actually already true for lots of agencies, right? We do our particular thing, and if you need us, that's the thing we do. But because we became such a gap filler especially during those first 6 months, we were getting calls from communities that we never interacted with in any sort of meaningful way. The mainstream homeless community definitely came online for us, and trying to find out how to best serve that community. Lots of folks who are unhoused, who choose not to go into shelters, were being targeted in the parks that they had tents, or under the bridges that they stayed. And so violence was visiting them in places that normally, I'm not saying doesn't, but the number was increasing. So we were getting calls from those communities. So we've learned a lot from the mainstream homeless community. We've made some good connections there. And I feel like we are better able to help our primarily homeless community when they call us. I think before we were sort of just looking at a list or reaching out to somebody we might have known. But no, in the last year, we've gotten really bilingual about how to talk to these different communities and say what we need, right? This is what she needs. Her meds need to go back online. How can we help make that happen, right? Where before we'd say, call this number, right? Where now we are able to sort of like physically stand in the gap. Like, we're about to put her in an Uber. Where's her pharmacy? We're gonna make this happen. She cannot be successful in any other thing we're gonna ask her to do without that medication. And so we really, really, I think the mental health community and the mainstream homeless community, we have really started working more closely with than I think we had in the past. So if the pandemic is going to give us a gift, I think opening our aperture around the communities that we've been working with as colleagues, not just as with our clients, because I believe we've always been getting those clients, but working with those colleagues across the line has really changed in the last year. Absolutely. Absolutely. And so now you can't unring that bell, right? You can't pretend like you don't know who to call for that thing, right? And so I think we are better suited and set up to help our clients in really meaningful ways that maybe we haven't been able to tap in before this.
Mm.
You know, I want to piggyback on that, because even in our small way, we just served whoever was referred to us. That's how Suited for Change has always done it. And it was always very busy. You know, there were 50 women coming in and out a week. And so we were filling a vital need, but we weren't thinking creatively. We weren't thinking, well, let's coach online. Let's mail the clothes if the woman from Fairfax can't get out to us. And something else that I'm going to just pitch to you guys that I've talked to, I've noticed that a lot of the women that came to us during the pandemic were women that lived somewhere. So they lived at House of Ruth, or they lived at Fairview. They lived at a place. And I started to think, well, what if we sent a closet of clothing at no cost to your shelter, Michelle? So if you had 5 black blazers or 10 black blazers or whatever in any size. So if you have someone with an emergency right now, sure, they're not going to get the whole experience, but let's bridge the gap. Give her this to get through tomorrow, you know, until she can get in and get the full clothing. You know, I've reached out to several places like yours, and we're in conversations to just, if you have space, which of course is a big issue for everyone, I will be happy to, you know, deliver and set it up and maintain, just so you have it, you know. I think we're all thinking more creatively.
Yeah, I would agree that with the creativity piece, and we've started to do video calls. So the case managers have started to do video calls with their clients. So that's a new thing that we didn't do before, but it's helpful. It's helpful to be able to see families without actually, because there are times even pre-pandemic where maybe the case manager wasn't able to get out to see a specific person. And bridging that gap with technology was really helpful. I think it also helped us get a temperature of what the technological difficulties or barriers were for our families, whereas before we didn't really pay that much attention to it. But we were able to get tablets to families. We were able to, you know, help families deal with any kind of internet situations they might have that might be making it difficult for their kids to be online. So I think the technological piece, I think, is going to be helpful for us in the future. I think it's something that I see us using more. And I think it's in line with how things are going in terms of service delivery. I, for one, am kind of old school. Like, I don't think there's any replacement for kind of a face-to-face. However, I do think that using technology to help bridge the gap when it comes to access. I think towards the beginning of the pandemic, when everybody's being told to quarantine, and when we were told to use different services to get food delivered to us, very quickly they realized that, oh, you can't use SNAP benefits to get deliveries. And that's something that changed. And so now families are able to use their SNAP benefits to get groceries delivered. And that actually that's a big, that was big in my mind. I think for a lot of the families, even though it seemed very minuscule, because now I don't have to travel with all of my kids to go to the nearest grocery store, which we know for a lot of the families that we serve is like 2 or 3 buses away. So I think there are ways that this pandemic has helped bridge some gaps. But like Michelle said, I also hope that we don't forget that there's a lot of equity issues that still are not dealt with appropriately. And I hope that we are able to kind of use experience as a case study for us to figure out what gaps need to be filled.
Sonia, exactly. I remember the first 3 months sitting in on the DHS calls about how they were sort of managing, especially with the homeless community. And I'm hoping that they rose to the occasion. I was completely impressed. I mean, and I always want to talk trash about something, but I was so impressed how they got porta potties out, they got hand washing stations out, they got crews out to keep those locations clean where people who were choosing not to come into the shelters because they were scared. And I want that to be the new floor, right? So now when we go back to normal, whatever that looks like, the porta potties stay, the hand washing stations stay, the extra staff stay, the delivery of the food from Amazon, you know, fresh stays, right? So now mom doesn't have to lug all the kids to the only Giant in Southeast, right? Mm-hmm. Absolutely. We found out very quickly, because our shelter is located in a food desert. One Saturday, I found myself in Arundel Mall, out in 50 miles away from my own home to find baby formula, like, because the shelves were bare, and our families, for the most part, don't have transportation outside of public transportation. And so we found ourselves driving around the DMV, not even the district, trying to find some of those resources, baby milk and all these other things that needed. And our donors really stepped up, right? Those folks who had Amazon Prime, I'd come home and there'd just be boxes stacked up in front of my door because we couldn't have them delivered to our offices anymore. And so we are grateful for the ways that people reimagined helping us. Food cards, and not just to a specific store, right? Where before they're like, we're going to give you this giant card. What Giants is bare, right? So suddenly people start sending us Visa cards, and you can just take it anywhere. You go to the corner store, you can go to a grocery store, you can go anywhere this card they would take it. And so I'm hoping people keep thinking that way and said, right, this is a different way. So if there's going to be a gift, that we reimagine how to give freedom and autonomy and grace to each other, but definitely to our clients that we share. So yeah, so I'm hoping that this new normal is that new floor, like we're starting from here instead of going back to how we used to do it.
Yeah, absolutely. I mean, Michelle, I completely agree. I think we've seen our community step up and step in ways that we didn't even know were possible in the past year. I mean, Sonia mentioned tablets. We usually do a back to school drive with traditional school supplies that quickly became a tablet drive and was able to supply, virtual needs that virtual divide, it's digital divide, it's still, a problem for so many. So speaking of community and community support, how can the communities that, people on this webinar, how can the community serve the clients that you serve?
I think as we go back to normal for the normies, right, who's maybe their life wasn't disrupted. Maybe you went remote and you got to work from home in your jammies and you basically managed your mental health and it was, it was cool. I think reconnect back to those community agencies that you've had relationships in the past and say, how can I help? When we can be in each other's space again, we're going to need volunteers, right? There's going to be ways that we have to reorganize our supplies, bring things back online, that we're going to need those physical hands to help us sort of sort through things that we had to set aside because we were focused on what was in front of us. So be open to that. Not just your wallets be open, but your physicalness be open. And I also think when you're in your community and you see people struggling, figure out how you can be of service to that. I'm not necessarily step in because maybe you're not trained for that, but call those numbers when they say somebody's in distress. Call and let them know that somebody's out here in distress. And they may not be able to do it for themselves. So maybe you can step in that gap in really short, quick ways. Pick up your phone, somebody's here struggling. Can you send, the hotline bus or whatever that is and get the help that people need. So I think be more present, be more focused outside of your own needs and see what's going on in your community, because really that really helped us. Yes, we had our main staff that was obviously paid to be there, but our donors and our helpers and our volunteers and really stepped up in ways that, as you said, we didn't even know we needed, right? We kind of had to sort of hunker down and said, we're just going to plow through. And they were like, we can make this a little easier. We can grease those wheels a little bit more. And that really, really helped. Absolutely.
I think what you said is just so important, Michelle. There are so many of us that just skated through this. And there are so many whose lives are knocked off kilter in a way that, they were already struggling and now, like you said, it's not over. And that's what everybody who's outside the nonprofit community has to remember. It's not over. It's not going to be over for a long, long time, for 10 years, it's not going to be over. Like Sonia mentioned, these children that are struggling. This is going to come back to all of us. So I just hope that the greater community remembers and has empathy and doesn't get tired of hearing about how people are still struggling. It's human nature to say the pandemic's over, let's move on. I don't want to think about that anymore. Like Michelle said, I want to go on vacation. But we have, as a community, we have to remember that members of our community, it's not over for them, not by a long shot. And so we can't get tired now. You know, this is the time to ramp up, not run out of energy. I mean, I need to hear that. I need to hear that every day. It's not time to quit. The finish line is not here. I think as a community, that's a story we need to tell. I want all of us to get together and have, you know, a trending social media, something that reminds people we're all in it together. It's not over. Keep running, you know? That's what I'd like to see.
Yeah, I agree. And I think, like we were talking about earlier, I think, you know, what happened these last few months is a combination of systems that never worked for us. You know, it's a healthcare system that never worked for us. It's a gender equity issue that never worked for us. And like I said, these domino effects, I mean, the mass incarceration rates and how a lot of the families that we work with, they have partners, but they're incarcerated, which means they're a single mom, which means that they can't work while, you know, their kids are at home. So all of these things really impact one another. And I'm hoping that people can, you know, definitely, you know, take steps to do what you can within your own home environment and, you know, if you see something, say something, like Michelle was saying, but also, you know, just remembering to pay attention to what's happening in your local legislatures and what's happening in politics, because I mean, a lot of these systemic issues have their roots in some kind of political landscape. And, you know, even with education and the fact that we now know that our whole society relies heavily on our education system to work, for those kids to be in school. And so, you know, really taking a look at how do we kind of rethink our education system so that if something like this happens, there are safety nets in place so that, you know, the people who don't get disproportionately impacted are the single women who are the people that are primarily caretaking for the children. And so I really hope that I'm always hopeful that our systems change, because, you know, I've got into social work to get myself out of social work, like I'm working myself out of a job is the way I always look at it. And, you know, we don't want to continue to put a Band-Aid on these issues that have been happening over and over again. And I think now unfortunately, when people now see people that aren't supposed to be at the food bank or aren't supposed to be at the clothing bank, you know, when people see that, I think the way that they view poverty, I think becomes a little bit different. And unfortunately, you know, sometimes that's what it takes, but I'm hoping that people can see that, you know, a lot of people, not just, you know, the people that are stereotypically seen as the people that are in poverty, but that a lot of people are 1 or 2 paychecks away from homelessness, and that homelessness isn't an issue about the person, it's an issue about these systems that have failed them. And I'm hoping that like we can get to a place where we start to tackle those systems. So I think, you know, in terms of what we can do, I'm hoping that we start, you know, like Liz said, to start doing the work now to tackle these systems that got us to where we are today.
And I think knowing also that the level of rebuilding that these families, not just our clients and families, the folks who were able to stay home, the folks who maybe kept their job, right? The kids are going to be struggling getting back to school. Some of the jurisdictions are starting to open back up. And the main thing that some of the teachers are hearing is, I'm just glad to have somewhere safe to go. Because remember, they've been locked down with all the chaos that the adults have brought into their homes, right? I think we're going to see just a tremendous need to rebuild everything, mental health, schooling, jobs, technology, everything is going to just, I think 2022 is about rebuilding all these people, and recognize we're also rebuilding some of ourselves, because we've had to sort of, especially as a helper, you've had to go into a certain position to get through this, right? In some ways I found like for myself, I've actually even had to put my private life offline in a way, because running the shelter became like the focus of this year, because we had to also take some of our staff offline to reduce the amount of exposure they were having to our clients. So we went to, some of our staff had to go part-time. So that means we still had we still had to staff that building, right? So it's been interesting how suddenly I'm exhausted. Like the last month or so, I'm suddenly like, why am I so tired? Because we've had to really focus on all the things were coming through that door, that we weren't able to pick and choose the crisis. And I think 2022 is going to be about the rebuild. And a lot of people are going to take, Liz might not be wrong, maybe take 10 years to get back to what they were right before this all happened. Because financially, a lot of people are going to be crippled by this. Absolutely crippled by this.
Well, thank you all for your thoughts. We have a couple of questions from the audience. A question from Charlotte. Do you see a particular age group that needs your services more? Like, has, you know, a particular age group been kind of disproportionately impacted in ways that maybe you didn't expect?
I would say we saw younger clients, but we were already trending towards that. Again, I feel like the pandemic really sped everything up. So whatever was coming showed up. It was absolutely on the doorstep by the time we were in the middle of summer. So yeah, I don't think there's an age group I saw increase as much as I saw the mental health piece, like the significant mental health consumers showing up. So not so much the age of the client.
Yeah, we do have a couple of contracts that serve older populations. And with those specific clients, they tend to be, before they come to us, they tend to come to us straight homeless. They're usually individuals. And for them, it was a lot more difficult to try to like just catch them or find them. And I also know that, I mean, for our older clients that we have, just being able, the isolation I know was a factor, and just making sure that we're asking the appropriate questions around, you know, any kind of symptoms they might be having, or making sure that they are going to the hospital when they are feeling sick. And some of the older clients not feeling comfortable going to the hospital, so delaying treatment because of their fears of COVID. But yeah, I think those are the main things that I've been seeing with some of our older clients.
Liz, how about you?
No, we see women of all ages.
We've talked a lot about mental health today for good reason. Angela wanted to know, I guess this is a question for Sonia, you know, where does the knowledge or ideation of suicide come from in children so young, you know, children under the age of 13, you know, where and how?
Yeah, so yeah, I think what people sometimes underestimate children about is their capacity to understand very difficult things, and the fact that they soak in everything, right? They soak in everything around them. And like anybody else, when your brain doesn't have the capacity to take in what they're experiencing, what they're seeing, sometimes you do kind of, you're reaching for things to either make yourself feel better, or you're reaching for something to get the awareness or the attention of somebody else. And oftentimes with children in suicidal ideation, you know, they will sometimes say things like, oh, I feel like I'm going to kill myself, or I feel like, you know, because they've oftentimes heard it somewhere else, and they've seen that person get the acknowledgement that they need. And sometimes children just don't have the vocabulary or even the capacity mentally to tell somebody, hey, I'm struggling here. Like, this is really hard for me. So sometimes children will kind of use something that they've seen work in other areas to get adults' attention. And so, you know, and children are very, I mean, mental health issues start very young sometimes. And oftentimes mental health issues get confused with trauma, right? So there's a lot of misdiagnosis because, you know, sometimes children are just experiencing a lot of trauma over and over again, and and they might not have a mental health issue. They may just need some coping skills, or they may need a change in the household dynamics to help them get to a place where they're okay. But yeah, children take in a lot of the trauma that is happening inside of their households, and children oftentimes they don't have a way to express it, or maybe they have expressed it and they've been met with either somebody saying that they're attention thirsty, or maybe somebody just kind of not really paying attention. And so whatever gets the adult's attention is probably what they're going to gravitate to. And oftentimes suicidal ideation is that thing.
That makes a lot of sense. And I think, you know, we're coming up on the end of the hour, and we have one last question from Lisa, also in the realm of mental health. You know, coming back to Michelle, what you said about rebuilding, and not just our clients, but also ourselves. So what have you all been doing to take care of yourself mentally and emotionally this past year?
Recently, as soon as I was qualified for the vaccine, I got the vaccine. I lived with a teacher who was housebound the entire year. And so every time I left the house, my stress was I was going to bring the virus back into our home. So right. As soon as that was, that's stress. I didn't realize how stressed I was about that possibility. And so grateful that we both got through it and nobody got sick. But as soon as I could, I got the vaccine, and I can't tell y'all what to do, but I encourage you, if you're open to that, to get it as well. And just, you know, schedule some time off. You know, yeah. It's been a solid year, and just take some time off and try to regroup, try to figure out what feels normal to you again, allow other people to help you, allow other partners to help you, like step back a little bit, be like, remember Miss Johnson? Here's your client back. So do some things that free you up to sort of to breathe and to take better care of yourself.
Michelle, I felt the same way. I was going into work every day while my husband was staying home every day. And I drove 7 hours round trip last Saturday to get my first vaccine, because that was also my stress. You know, we can't not serve these women that need you. And that was the constant fear that I would bring at home as well. And my coworker, Fernanda, would be so mad at me if I did not say, we need to practice self-compassion, because it's so easy to think, I'm not doing enough. When we're exhausted, the constant stress, like what Sonia said, we're experiencing that too. The constant stress makes it impossible for you to think clearly after a certain point. And we have to find a place to give ourselves permission, like you said, to take time off. I know, like you guys, we've all just plowed straight through this year, working 12-hour days, trying to stay relevant, to stay viable. Also, I mean, we need to talk about fundraising. Let's not end on that note, but it costs money to run these organizations, and we had to right? We had to really, really fundraise like crazy at a time when it was really more important to give money to feeding organizations than mine, you know, and it was, I agree. But so we're going to have to remember when we get to that rebuilding year, like Michelle said, 2022, that we're going to need to rebuild ourselves a bit too.
Yeah, I agree. And that, you know, that compassion fatigue can really creep in when we don't take the time to take care of ourselves. I'll say that we have really great case managers who are actually the ones on the front lines, who are actually going out to, sometimes they do go out to make home visits when there's a need. And one of the things that we've tried to do within permanent supportive housing is really make time to do fun things. Like we went axe throwing not too long ago, and they had like a Jeopardy thing that they did online. And so we've really made an effort to try and infuse our work with fun in like little ways. And also the acknowledgement from the supervisory staff that a lot of case managers, even the supervisors, are working and taking care of their kids, and how difficult that is to work with a lot of clients we have who do have some very severe mental health issues, and not having that barrier between those clients and your home life can be really, really challenging. And it can be really challenging getting cussed out at on the phone while your little one is playing in the corner, sometimes, which happens. And so we've really tried to make sure that we are taking care of the staff who are on the front lines and who are really inundated with this on an everyday basis, and figure out ways to better support them. And for ourselves, like Michelle said, taking time off and really, doing small things every day to help reduce that anxiety, whether it's, taking a walk or, and also with the Zoom space, doing things like, giving people permission to, go on a walk while they're on a call, or, take more breaks in between Zoom calls. It's also very difficult I'm sure everybody is aware of all of the meetings that all of a sudden everybody wants to have all the time. And so that also takes getting used to, because if you're in meetings all day, it's like you don't have time to do the work. So really finding ways to reduce our figure out ways to do the work while acknowledging kind of our humanness, and letting that be the first thing. And then, work will happen, but we can't do this work if our case managers are burnt out, or if we're burnt out, or if we don't have the ability to actually be present for our clients.
Yeah, absolutely. My motto of the past year has been to give yourself grace. And know that this is not normal. None of this is normal. And it's irrational to expect to have a normal response and carry about your life in a normal way. But I want to thank you all so much for your insights, for your time. Thank you, attendees, for joining us. And we'll follow up with some resources and different things that our panelists have mentioned for the evening. But thank you all. Stay safe, get vaccinated if that's in your wheelhouse, and continue to take care of yourself. Have a good night, everyone.